initiation adolescent cycle. Okay. Now, Imtiyaaz, I would like you to put off your spectacles. It will make you more comfortable. Now, by now you might have seen several demonstrations of induction. So, some general points to be taken care of, that the mobiles are to be switched off. So, let me also do that. Please put off your mobile. इम्तियाज़ तुम्हारे पास नहीं है ना? दे दिया, that's good. बंद करके silence. So how will you? Yes, that will be wonderful. We can put some mattresses on the floor here so that people who are not able to see from the bedside, they can sit on the floor. That's a good arrangement for a larger room. So some general considerations like silence in the room. Here, because it is a demonstration, we will keep the lights on, but otherwise I prefer little dim light. Not totally off, but little dim light. Then, of course, the client should be comfortable. So, funny, you, okay, funny, right. Now, why do we give pani, water? During relaxation, in many people, there is reduction in salivary secretion, and that may cause little feeling of dryness in the mouth. To avoid that, we usually ask the person to take little water before starting to keep that wet feeling in the mouth. So that is physical preparation. Mental preparations are required, which are done during these 2-3 days. The basic thing is to discuss what hypnosis is not and what hypnosis is. So that day I told you all those misconceptions are to be cleared, and then depending upon the client's education and intellectual standard, you need to explain what it is. So to Imtiyaaz, I would explain that conscious-subconscious corollary. I would explain him this dissociated, concentrated focus of attention, all these things, because he's a psychology student. But with other people also, with lay people having other education than psychology and medicine, with them also, if the person is educated, I prefer to discuss all these things. With full knowledge about what the person is undergoing, the person will be able to do it better. So all these preliminary things are to be done before you take the client. So generally in my practice, I induce trance in third session, not even in second session. First session is for history taking and conveying what the whole thing is there. Second session is for learning some simple technique like breath watching and if necessary relaxation. Of course, simple breath watching and relaxation can induce trance. These are also techniques of induction of trance. But usually, by third session, I go for this full-fledged induction of trance. Okay, so with this, I think Imtiyaaz, we can start. Are you comfortable this way? Yeah, you can keep like this or whatever way. It is more comfortable, and in between, if it is required, you can move also. As far as possible, unnecessary movements are to be avoided, but when the movement is necessary for being more comfortable, you go ahead. Okay. So Imtiyaaz, you are sitting comfortably. Generally, my way of sitting is like this. I face client's face. I sit like this and do it. But because I want to also attend you, maybe in between I will keep changing my posture. But this is the way in which you need to face the client. Okay? So Imtiyaaz, sitting comfortably, you may like to keep your eyes quietly closed. Earlier I used to say, I would like you to keep your eyes closed. And now I say, you may like to keep your eyes closed. There is a big difference between the two. Okay? Like gradually making it more and more permissive. It's a permissive approach, not authoritarian. So Imtiyaaz, with your body comfortably resting and your eyes quietly closed, if it is necessary, you may move further to make your body even more comfortable. That's very good. And now, you may like to attend to the process of your breathing. Your normal, natural breathing, which is going on all by itself. You just feel and sense, experience the process of your breathing. Breathing in, out, in, out, in, out. See how your body is relaxing every time while you are breathing out. As we breathe out, our body would relax more. As your breathing continue normally, naturally, at ease, Imtiyaaz, I would now like you to slowly open your eyes. Open your eyes slowly and look up over here at the tip of this pen which I am holding in front of you. Look here at the tip of the pen. Of course, blinking is allowed, but let your gaze be fixed at the tip of the pen. And also, while you are staring at the tip of the pen, Imtiyaaz, you may like to start counting in your mind silently from 300 backward. 300, 299, 298, 297, and so on. Keep counting backward silently in your mind and keep watching the pen. As you continue counting and continue staring at the pen, your eyes may start feeling heavy. They may feel more and more heavy. Can see the pen is slowly coming down. Pen is approaching your forehead. And as the pen is coming nearer and nearer to your forehead, your eyes